So let's start with the any questions that you have around just this whole idea that I'm coming from, that I've explained in the book, around what's really causing the focal dystonia. So the activation in the nervous system and where that and why that has occurred. Does anybody have any questions about that?
I have a question about that.
Yes.
If the nervous system is being activated,
Mm-hmm.
why do we experience focal dystonia only on perhaps one hand and not the other hand?
Mm.
The nervous system, I'm assuming it's a totality, so I'm wondering why is it focalized in one area?
Good question. So the nervous system is activated overall, okay, and then one of the things that creates is a dissociation. And it seems for most people, and it's not for everybody, Victor Wooten, for example, when I began working with him, he had focal dystonia in both hands. Okay. But for most people, there is an asymmetry in the body. So what happens is the dissociation is greater on one side of the body than the other. And I have a lot of people that I work with where they go, for instance, my left side of the body, maybe that's the side where the dystonia isn't appearing. They go, the left side of my body feels really normal and I feel connected to it. I can feel into it. But the right-hand side of my body feels somehow cold or less alive or heavier, or, there are lots of different adjectives that they would use. So on the right side. So, so that asymmetry that's happened, that is natural in the body, the dystonia gets expressed into the side of the body that is more dissociated. That has to do with the brain as well. Okay, and if any of you at any point do some brain spotting with a brain spotting therapist, you may well find that at some point they ask you to cover one eye up and work with just one of your eyes. Okay, the reason for that is that within your nervous system, when there is an activation, there's part of your nervous system that is activated, but there are areas in your nervous system that is still very resourceful. And one side of your brain works with the activation and the other side of your brain works with the resourcefulness. So for instance, I have a guitarist that I'm working with who the level of the activation in his body is extraordinarily high, meaning that his hand does this all day, not just when he's playing his guitar. It's doing this all day and he has pain in his arm almost all day. Okay, now that's a very high level of physiological activation that's going on. So what I did was I found, when I worked with him at the beginning, was to find the resource eye. So if he covers his activation eye up, so that's the bit that's connected to the activated part of the side of the brain, and we just work with the resource eye, the hand was a little quieter, and we could actually begin to do some brain spotting in a much more effective way because of that. Okay, so that's why we find this asymmetrical aspect oftentimes to the focal dystonia.
Thank you.
Thank you. Great question. Any other questions on this the underlying causes?
I got one for you, Ruth.
Thanks, Brian. Yeah.
So what happens if you don't really fit the mold of lack of attunement growing up? Because quite frankly, I didn't really have any issues growing up. However, I do remember even as a small child, 1, 2, 3 years old, I'm just sort of being born with that high level of activation anxiety. And
okay.
That's the way I've lived my life for the last 47 years.
Okay, so there may be other reasons why that's happening. Okay. I believe that the vast majority of us experienced a fairly severe attachment break at the moment of our birth. And what do I mean by that? I mean that the natural birth process is that when we're born, our lungs haven't started to work yet. There is a few minutes where there's naturally the smooth transition from the oxygen reaching our body through the umbilical cord and the oxygen reaching our body through our lungs. So what happens is the umbilical cord slowly begins to stop pulsing at the same time as the lungs begin to breathe. So that's what would happen naturally. I was brought up in the countryside, actually, and I think I mentioned something in the book about lambs. So my best friend's father had a sheep farm, and so from a very young age, I would help with the lambing. So, I witnessed that, how that's a natural process during the birth process. What's happened for most of us is that the moment we were born, the umbilical cord was cut. And what our body said is, I'm not getting any oxygen. My first experience of life is an absolute survival experience. Life and death. Okay. So, a lot of us go, I haven't had any attachment breaks, or I haven't had any trauma early in life, but most of us actually, our first experience of life was traumatic. And that can be enough to initiate that happening. And then sometimes there are things that have occurred to us that we just don't know about, falls that we might have had as a child and banging our head, for instance. There may be any number of things that are in the nervous system. I haven't yet come across anybody where there is no initial cause. But that doesn't mean that we remember what that cause is. Okay.
Actually, I do remember one of them, and it's kind of a funny story, but my mom had left the house and my dad was watching me, and I rolled down a flight of stairs, and I was about 14 to 16 months old, and I actually remember it. And
there you go.
I don't remember the beginning of the fall. I don't remember the end of the fall. I just remember the tumbling in the middle. Okay. And so that your articulation of that of what you just went into kind of reminded me of that. So maybe that's part of it. I don't know.
It may well be. And usually when we have a vivid memory, that's a good sign that that memory has not been effectively integrated into the brain.
Interesting. Okay.
Yeah, so that may well be. And I've worked with people that they've just had something like that, and that's been enough to initiate then their nervous system getting stuck.
Interesting. Okay.
Yeah.
All right, thanks. That helps.
Yeah, great.
I have a question.
Yeah.
Hi, Ruth.
Hi, Jeff.
Is there an advantage to knowing what the event was that precipitated at this early attunement break? Is it? Do we need to know that? Is it helpful to know that, or is that going to resolve through the process?
That's another fantastic question. We don't need to know what it was. Okay. What we do as we work through the brain spotting, and you'll find a lot of that you can do on your own with what we call self-spotting, which I described step by step in the book. There can be maybe any number of doors that we can walk through in order to connect with the neural network that is causing the activation in your nervous system. That can be a memory. Okay, for some people that is a memory, and we can use that as a doorway to access the nervous system. But it can just be a physical feeling in the body, or it can be an emotion, or it can be a type of kind of thinking pattern that we have. So any of those are doorways that we can use to get into that neural network, and the deep brain will resolve what it needs to resolve as we brain spot, and that will become reintegrated in the brain, and then it won't be activating the nervous system any longer.
Thank you.
Thanks, Jeff. Any other questions?
Hello.
Pradeep.
Hello. I am Pradeep. I am a 67-year-old musician, percussionist, and I would just like to know whether the dystonia recovery is age dependent. If my age is more, then it will take more time to recover. Is it like that?
No, it's not. So actually the person who resolved their dystonia the fastest with me, he was, I think, in his late 60s. He'd certainly been retired for many years, and his age doesn't really have an impact on how far the brain is extraordinarily plastic at all ages. Okay, what impacts how fast the dystonia will unravel itself are two main things. One of them is the complexity of the experiences that are underlying the dystonia. Okay, so in my case, it was many years of therapy, because I hadn't come across Brainspotting then, and then, you know, quite a significant Brainspotting process that enabled me to come back to, I had embouchure dystonia, enabled me to come back to really full functioning in my embouchure. And the reason for that is that I have a very complex trauma history, and that goes right from pre-birth. Okay, and it's at and it's at many different levels. Family issues, issues at my school. I was brought up in a very white supremacist area of the UK, so I received constant racism as a child. That came right through into my music, where I wasn't allowed to play on stage because I wasn't white. You know, so for me, there was a very complex. I have a very complex trauma history, and so that meant that there were a lot of things to work through in order for all of this just to really come into relaxation and well-being. So that's one of the things that can make things slower to work through. The other thing that can make things slower to work through is our ability to be able to associate into the body, to be attuned to our physical body, which is why I start the book with that exercise. So the more able you are to, or the higher your interoceptive sensitivity to your physical body, to be able to inhabit into the sensations in your physical body, the faster you will be able to resolve your dystonia with the Brainspotting. Okay, so that piece of work is really, really important. That's why to talk in the book, there's no need to hurry this. Really take your time. You know, for some people, that's really difficult to come back into the body. It took me a long time to come back into my physical body because there was so much trauma there. It was really uncomfortable. It was really activating for me to be connected into my physical body. So that took me a long time. And it's about, this isn't, you know, there's no hurry with this process. It's about just coming back into a place of being really present with our process and loving in our process and the time that takes.
Yeah. Thank you. Thank you very much.
Thank you.